Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hey everyone, welcome back to our series of What Is That? Today we're going to be talking about Morpheus8. This is a microneedling with radio frequency device. So if that doesn't mean anything to you, let's take a step back and talk first of all, well, what is microneedling? Microneedling is an aesthetic device, and as the name implies, micro, tiny, needle, tiny needles. So it is this handheld device. It can be either battery powered or electric powered. And it literally has anywhere from, depending on what device you're using, 20 to 30 little needles. And it's basically the treatment person or esthetician or skincare specialist slides this device across your face. And these tiny little needles go into the skin, creates a controlled injury. And then when your body heals, it stimulates collagen and elastin and is a great aesthetic treatment. Radio frequency is a type of energy, type of heat that when combined with microneedling, you get even more kind of a bang, and it's definitely a more aggressive treatment because not only do you have the little needles going into the skin, but then when the needles are put into the skin, radio frequency is also delivered. So we use this treatment literally all over the body to stimulate collagen and elastin. So why would somebody get this? It treats, like I said, the whole body. The most common place we use it is obviously the face, and people are using it for fine lines and wrinkles. Also, great treatment for acne scars, chickenpox scars, poor skin texture, deeper lines or creases, enlarged pores, surgical scars, cellulite, stretch marks. What also is really nice about this Morpheus treatment, unlike traditional microneedling where it doesn't go as deep, this device can go several millimeters deep. And so what we do in our practice is we will target different depths to achieve different results. So depending on what our target is, we might make the device go 1 millimeter, and it could go to 2 millimeters, 3 millimeters, and 4 millimeters. And we will vary the depth based on what we're trying to achieve. If we're trying to target deeper lines or actually cause a lifting, or even it can also help with some mild fat melting, particularly underneath the chin. So we'll go deeper for that versus if somebody has superficial lines, then we won't go as deep. So we usually do several passes on the skin. We certainly have a nice protocol with numbing medicine and nitrous oxide because, as you can imagine, having needles along with heat go into your skin, it can be a little uncomfortable. So it's important to go to a place that has a comfort program in place to help during this procedure. The procedure itself, depending on what area we're treating, in general takes about 20 to 30 minutes. So a full face usually takes about 20 to 30 minutes. One treatment typically consists of 3 sessions, anywhere from 3 to 4 weeks apart. And then after that, I recommend our patients do a maintenance treatment anywhere from 1 to 2 times a year. I think it's really good for people to do a collagen building treatment periodically based on your age and aesthetic goals every 6 to 12 months. Hope this helped of informing you what Morpheus8 and RF microneedling is.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.